Well, that's right. This is where we say good evening to everyone plugging in. And, of course, welcome to our special show on a Tuesday evening. Welcome inside our Men's Health Clip Hour here on 103 FM. Of course, this segment is all being sponsored in part by our friends at Valpark Chinese Restaurant this evening. Let me say good evening going out to Mr. Dennis Webster. What's up?
Hey, everything is good. Thank you. Thank you, Greg. Good evening, ladies and gentlemen. And again, welcome to the 103 FM's Men's Health Hour. The show is about men's health, so we're going to touch on various men's health issues. If you've been listening to the show before, you know basically the topics we cover. And if you're new to the show, welcome. Before we get started, I'd like to remind you that you should always seek the advice of a physician or other qualified healthcare provider if you have questions regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you've heard on this radio show. So our topic is men's health, and reports state that basically men's health affects the entire family. And women are very proactive about getting themselves checked, but men seem to delay for some reason. We believe that they feel they need to be strong all the time. If they're having pain, they're afraid to report they're having pain. If they're having urinary problems, they're afraid to mention because they feel they need to be strong all the time. So I just like to get the message out to them that if you're having a problem, you need to talk about it.
Correct is right. I mean, often at times, even myself, you get a little pain, but at home, you don't want to say anything to your mom or your dad, or even your brother, your partner, as we say in these modern times.
Right. And
it's something that you need to really look at carefully, because if you're getting a pain to all the men out there, nobody will know if you don't say something.
Exactly. And it goes, as I say, with all the other issues, with urinary issues, sexual health issues. Men have problems with high blood pressure, high problems with sugar. I don't know how many of them actually have all the information that they need to have on these topics. So in order to get the information, you have to ask the questions.
Well, actually, it goes across the border, Mr. Webster, with all ailments, from a simple little virus.
Absolutely.
It can go all the way up to a lot of complications. So,
Absolutely.
Men sometimes, we think that we're too macho, so to speak, to tell our better half, our partner, our family, our friends, our close friends,
right,
what's happening in life or what's happening in our life.
Exactly. And you feel there's some shame, associated with having a male issue. And, as I say, if we don't address it sooner rather than later, then it becomes, a big problem.
Now, to all the men locking in as well, you can call us. Don't be shy. Don't be too macho to call us if you want to get some information. And, ask your questions. Our number is 628-4103. And even this, Mr. Webster, men, I think, just back away. They just listen to the program and they don't really come forward and call and ask a question. Yo, what's up?
And they have questions. They have questions, but they don't want to pick up that phone and call. I was thinking, maybe we should be marketing some sort of device where, men could probably, disguise their voice, and maybe that will get them to call in, But, it's men's health is important. I mean, we know what our mothers mean, to our children, but, the health of our fathers is also important. And as I said, one of the, reasons that men's health is struggling is because of the way men view their health.
So, men, don't be shy. Just hit us up, send us a message.
If you have an issue, give us a call now.
And we can probably give you a little advice as to how to deal with your situation. Now, Mr. Webster, young people in particular, young men.
Right.
I mean, they're growing up. We're getting into 20s, early 20s. They just are living up, enjoying life.
Right.
What would you say to young men that's out there that's just enjoying life in terms of the liming, eating, drinking? What are some of the things that they should be mindful of in their youthful days? Because, sometimes you meet friends. I mean, I meet a lot of peers of mine.
Right.
And they often say, well, nothing wouldn't happen, I got to go healthy and strong. Not paying attention as to complications that may arise later down in life.
Absolutely.
So what would you say to the youths, to those in that young bracket?
Well, first thing I would like to say to them is that they should, continue to enjoy their lives.
Right.
But they should be doing things in moderation. I mean, there's some things we absolutely should not be doing. One of those things is drinking and driving. That is a bad combination. So if you plan on going out there and you're partying and you're going to be drinking and having a good time, make sure you have a designated driver, someone who's not consuming alcohol. I mean, we're losing too many young people, over, motor vehicle accidents, due to, drinking and driving. So that's one of the things I would recommend that they avoid. Smoking. One time it used to be a cool thing, right? Everybody, have a cigarette. You couldn't wait to reach a certain age to buy your first pack of cigarettes. Yeah. But we know lung cancer is a big issue. So, one of the things.
That, as you mentioned, that happens to be one of the things that are the norm these days with the youngsters. They all think it's so cool to be puffing that cigarette or pulling that cigarette, and then they even graduate to a different bracket and a different category altogether. Which we won't go that far, but especially young men in society today.
Absolutely. So be aware. It's your health. This is not a dress rehearsal. You only get one chance, basically, to keep your health right. So, take full opportunity and pay attention. Pay attention to your body. Listen to your body. What's it telling you? Is there a problem? If there's a problem, go see your doctor. Is there a...
we had a call coming in. 628-4103. I think we lost it, though.
The call is gone. Okay. So, one of the recommendations also is that fathers should set an example for their sons, and by making an appointment with a healthcare provider and getting checked out. And healthy men make healthy families. So we need to send a clear message that asking for help is not a sign of weakness. It's actually a sign of strength. I think we have a call on the line. Hello, you're on 103 FM's Men's Health Clip Hour.
Hello, good
Welcome.
night.
Good night.
You are live?
You are live, dear.
How are you?
Oh, very well, thank you. And you?
I'm enjoying the program.
Wonderful.
What's up? I have a question, right? Anytime I ask my dad, or I always hear the question, why do guys don't like to take a shower? They take a shower in the morning, they fight to take a shower for some reason. You have to nag them to go to the doctor. They don't take care of themselves. Why is that? Is that ego, or what causes men not to take care of themselves? When you go to the doctor, is only women. You hardly see men.
Well,
I don't understand why.
Well, you mentioned the shower thing, so I don't think I have an answer for why they're not taking a shower. I mean, it's important. I mean, we need to keep clean. But men, I think men in general, they just don't like to say that they have a problem. They feel that they have to be strong all the time and that they're bulletproof. Until a problem arises, that's a serious problem. So they need to be encouraged. I mean, if you have a partner in your life, you need to be encouraging him to get checked out and, to be safe. It's important. So, as I said, I don't know why they're not showering. It's important to cleanliness is next to godliness. So they should be taking regular showers. But they should be discussing, any complaints or any issues that they have. They should feel comfortable to discuss that with their partner and their family. So that's the message that we want to send out.
We have another call, Mr. Webster.
Yes, hi. Hi, caller. You're on 103 FM's Men's Health Care Hour. Welcome.
Hi, good night.
Good night.
I've been listening to your show and your program for the past week. So.
Have you enjoyed it?
I think it's a great way in which your show highlights a topic which far too long has been neglected. I would like to hear and learn more about the issues concerning medical malpractice, especially in Trinidad and Tobago. Recently, I read on the daily newspaper where one Justice Frank Sipasad concerns of the need for an independent board. I personally would like to say I praise Justice Sipasad for his own independent mindset.
Absolutely.
Of such a bold call.
Absolutely. I join you on that.
I say bold simply because far too often people become quite too comfortable in their positions as medical professionals. In my own experience, I encountered as a patient or even as a relative of a patient gross insults and I quite often fed doctors unwanted, altered egos. My hope is that for those who may be listening to your program are somewhat encouraged or becomes aware that medical malpractice is quite prevalent and very much alive right here in Trinidad and Tobago.
Absolutely.
And we need to be vigilant and somehow find a way to raise awareness
Right.
So that reform is made possible to help the helpless.
Absolutely.
I think that's now is a good, most opportune time right now to welcome Justice Sipasad's idea of reform.
Absolutely. Absolutely.
But
Thank you.
that being said, people need to be brave and speak out. God's word is that, and faith comes, not fear.
Right.
We can't put fear in front of us because far too often people's families are treated negligently. And this has been a great letdown. I'm not bashing the medical professionals out there. I'm simply stating from my personal point of view.
Right.
And it hurts when something like this happens to someone.
Absolutely.
Thanks for your shared knowledge.
Thank you for your call.
You're doing a great job.
Thank you for your call. We appreciate that. Thank you very much. Yeah, it's a big problem that we have in the country. I mean, Greg, I mean, it's, we have, what I refer to as rogue healthcare providers.
Correct.
I mean, I saw a guy this week, fellow came and seen me and did his blood pressure. He was obviously hypertensive. And he says, well, that I had that reading before, and my doctor said there's no problem, right? So,
really?
Oh yeah, I mean, hypertension. You're putting people at risk for heart attack and stroke. So, we have rogue practitioners out there. We have great practitioners out there, but they're basically getting,
they're getting tied up with the amount of patients and the money at the end of it.
Well, that's part of it, but another thing too is the rogue practitioners are shedding a very poor light on the good practitioners.
Right.
So we need to have some sort of system that identifies these rogue practitioners. And in some cases, these practitioners, just don't have the information. Yep. So it's not a matter of pointing fingers and name calling. It's finding where the gaps are in our healthcare system, right, and filling them. If it means someone needs more education, getting them the more education that they need to get them up to standard.
Yeah, well, they need to actually take the steps to better themselves.
Absolutely.
Because dealing with the John public, as we say, you need to have everything in order. It's people's lives you're playing with.
Absolutely.
So if let's say somebody comes into your office as a doctor or as a medical practitioner, and let's say they have the virus, for whatever reason, but you treat them for something else, then it tends to do more harm than good.
Exactly.
So to all medical practitioners out there, if you're listening in, we're not bashing anybody.
We're not bashing anybody, no, but we want, basically the good ones to get the recognition, that they deserve.
And the not so good ones to get up to the standard that they should be.
Absolutely. Absolutely. We're all in this together. Healthcare, it's for all. So we want all to receive the highest level of care possible. So that's what it's all about.
Remember, you can call us. You can give us a call, ask your questions. Give us that call at 628-4103. Also, you can send us a message at on our text board at 4103. To those of you online, you can log in at 103fm.net. Check out Mr. Dennis Webster and yours truly, Greg. We're here discussing men's health every Tuesday from 9 to 10. Of course, at this time, we take in a quick commercial break. We take in some messages and we come back to chit-chat some more about men's health. Welcome back inside your Men's Health Clip Hour right here on 103 FM. Now we're discussing men's health on the whole, and I know you men are plugged in, listening very closely to your radios, and you're having an issue. This is the thing, with us men. You're having that issue, but you don't want to pick up that telephone and call us and give us your, share your story or even ask a question, hoping for us to discuss your issue or your problem. So all the men plugging in, you need to pick up that telephone and give us a shout and let us know what's happening, what's going on, what you're experiencing. Are you having troubles? Are you having a lot of problems? Maybe we can help you. We can give you some advice here. So actually work out your situation and your problem.
Absolutely. So they're waiting for somebody to call in with their problem, right? So they don't have to call in and So, remember, if you keep doing, the same things, over and over again, you're going to get the same results. So if you want to change, if you want an improvement in your health, you're going to have to make a change in your approach to your health. And the first part of that is basically, recognizing that you have a problem and that you need help with it and seeking that help. So we're going to encourage you this evening that if you're having a concern, you're not sure, and you'd like some sort of feedback, give us a call. We're here to help you, 628-4103, or send us a text at 4103, or you can log on at 103fm.net. The topic is men's health. One of the topics, as I mentioned to you earlier, Greg, that we want to touch on is depression in men. Now, there's a stigma associated with men having mental health issues, but it's a real issue in men, and it's a real issue to the point where a significant number of men get into trouble. Like suicide among men is 4 times higher than suicide among women, and men are actually more successful at suicide than women, and they usually choose more violent methods. So, you want to be, if you're a partner, of one of these men, you want to be paying close attention, for these signs and symptoms, that your partner could be having some depression. I mean, is he having, difficulty sleeping? Any issues, maybe his appetite is poor. You're noticing mood swings. Maybe it's time that, you start speaking with your partner about these issues, and it may be helping him to get some help. I mean, there are real issues affecting men and affecting the family. I mean, he has a problem, but it's going to impact on everyone. So I think it's important that, we address these things early.
As you mentioned depression, Mr. Webster, what exactly leads to, depression in men more so?
Well, I mean, I don't think there's anything in particular that leads, to more depression in men than women. I mean, they're both susceptible, to depression. A lot of sometimes it's, there are hormonal imbalances. Testosterone is one hormone that if that level is very low,
right,
you can get, depressed. So, depressions are basically symptom. Depression is like a symptom of something, going on, and something needs to be checked.
All right. So somebody is going through depression. A man is going through depression. What what measures can he take, or what measures can his family take once they know of his issue? The first for him to help him get out of it or to solve the situation?
Well, the family by themselves are not going to be able to help this, so you're going to need to have some sort of, professional guidance.
Right.
So I think the first thing to do is, if you notice it, basically, mention it, talk about it. You basically describe to your partner what you're seeing.
Right.
Find out from them really whether if there is a problem, is there something else going on. So if you notice that, signs that are basically out of the norm, talk about it, bring it up. Say, hey, I notice, your mood seems to be a little off now. Usually, a little bit more upbeat.
Yeah.
Is there something, going on that, I can probably help you with? Offer assistance.
But sometimes men will just say, I'm good, all is well.
Yeah, but
that type of thing.
So you persist. It's a squeaky wheel sometimes that gets the grease, right? So, you have to basically persist. Say, well, you're just not looking like yourself, and I'm concerned. Express your concern. This is the only way they're going to basically, come out and try and get some help. And, even in some situation like that, there are some men that are just going to refuse.
Yeah.
Period. So in a situation like that, you're basically stuck. There's very little you can do. But I think pointing out what you're seeing, bringing it to their attention sometimes even, increases their awareness.
Yeah.
Hey, maybe there is a problem. Maybe there's something I need to go, have checked out. So things like that. Now, for young men, I want to mention about young men also. The age 20 to 35 is really the age group where testicular cancer basically becomes a problem. Now, it's more common in the Caucasian population, but I think for men 20 to 35, testicular checks is something they should be doing, and there are great YouTube videos available that shows you how to do that properly.
Yeah,
it's one of actually the cancers that are actually almost 100% curable if caught early. So
right.
For young men out there, consider testicular checks. I mean, you need to actually do it, probably once a month, but it's good that you get more, how to.
So you actually recommend that you do those testicular checks from the age of 20?
Starting between the age of 20 and 35 is when men usually get diagnosed with testicular cancer. So around the age of 20,
it's a good time to start checking.
It's a good time to start checking. Yeah, they say, as the saying goes, got no one to hold them. So that's a good time to start, checking for testicular cancer. If you're having pain in your testicles, is any swelling, those are signs that, something needs to be checked out.
And again, men, you need to come out front and say what's happening.
Right.
If you're having an issue, you can discuss it maybe with your parents. If you can't talk to your parents, obviously, your partner, I'm sure, which you could relate to and explain your situation. I'm sure they would be able to take you to the right people.
Men are very eager to tell men about, nice tablets that they can take, right? So,
correct.
You could talk to your partner also if you're having an issue with testicular, pain or swelling or anything like that. get it checked out. Prostate cancer is a very, scary thing, to think about, but prostate cancer treatment, it has come a long, long way. So, this big C word that, that we're usually afraid of, we have great treatments, and men are living long, productive lives with prostate cancer today. So don't be afraid to get checked. According to the Trinidad and Tobago Cancer Society, men are getting checked starting at age 40. So if you're age 40, it's time to get checked. If you have a father or a brother who's been diagnosed with prostate cancer, you should probably be, getting checked earlier, probably starting around age 35. Remember, a significant number of these cancers can be cured if detected early.
Yep.
Okay.
So you need to run that check as early as possible. The earlier, the better.
The earlier, the better. And it's not about that PSA test. Okay. So that's another thing we have to get our medical practitioners on board with, is current guidelines with regard to checking for prostate cancer.
Yeah.
Okay. So these are some of the issues that are facing men today, and that can impact, negatively on a man's, life if, they're not addressed.
Remember, you can call us up at 628-4103. Any questions, any suggestions, any information you want to share with us?
Absolutely.
Feel free to give us a call. You can send us that message to 4103 as well.
Right. Now, men are also very interested in losing weight. And, I think, they should keep in mind that there are safe ways to lose weight and unsafe ways to lose weight. So if you're not physically active, or you haven't been physically active, for some time, and you're overweight, I do not recommend you take up any sort of strenuous activity, right off the bat before checking with your family doctor. So don't try and do a Usain Bolt sprint, or, around the savannah if you haven't been exercising for a while, because you put yourself at risk, for heart attack. And I've seen this happen. So it's not uncommon for this to happen. So check with your family doctor. Maybe you want to have a consultation with a nutritionist with regard to any of your weight loss goals that you have. There's safe weight loss and there's unsafe weight loss. So check with a professional before you undertake, any sort of, thing like that.
What about, as you spoke about weight loss, Mr. Webster?
Mm-hmm.
I know a lot of young men these days tend to, go to the gyms and that kind of thing. What is your advice to those who head out to the gyms at a very tender age? I'm seeing, young men at the gym maybe from 13, 14, 15 years. Mm-hmm. What is your advice? Because I see some of them training really, really hard at the age 15, 16, going to the gym. At least on my end, I see some young men, at least now it's vacation time, and they come out and they're training more than me.
Right.
So what is, is it the right thing? Is it...
Well, it's hard for me to say whether it's the right thing or the wrong thing. What I would say is, exercise is good.
Right.
We need to be exercising at least 3 times a week. But if you're going to be going into any sort of a strenuous exercise routine...
At that age?
Yeah, you should be speaking with, maybe a professional trainer, and see what it's safe for you, basically, to do. Because you could overdo it and you can injure yourself to the point where, you can't basically...
Could end up in more complications.
Absolutely. You get into more, problems than you're looking for. So, best to check with a professional before you jump on board any vigorous sort of exercise routine. As far as losing weight also, I was reading recently where one of the recommendations was for people who want to lose weight is that they have a glass of water before meals. Apparently, if you just did that one little thing, you could probably lose about 8 pounds in a year.
Serious?
Mm-hmm. They say apparently drinking a glass of water before meals can reduce your caloric intake by about 75 calories per meal. So if you add it up over a year, you can probably lose about 8 pounds. So that's a little thing that men can do, to try and, lose weight. Also, having more frequent small meals as opposed to 3 large meals. Yeah, that's also a current recommendation for losing weight.
Also, I read, is it green tea?
Mm-hmm.
It's good for losing weight as well.
It has antioxidants in there, so it has many health benefits.
And lemon water, I believe.
Mm-hmm. I've read about that. I don't know if any clinical trials
have been done
to support that, But yeah, I mean, a lot of, as I said, conventional, medications come from natural sources. So there are benefits to natural sources. And if you're considering, using natural sources, it may be best that you speak to a naturopath, someone who's, experienced in that area, who can advise you, best on how to proceed if you're looking at, doing something like that.
Welcome back inside your Men's Health Clip Hour here on 103 FM, discussing men's health. And of course, you can feel free to give us a call, all right? 628-4103. And do let us know, ask us a question, share some information with us as usual. Mr. Webster?
Yeah, so before we continue on, I'd like to give some information to the listening audience. First of all, I have set up a blog with a lot of this information that actually we're discussing on the radio shows. And the blog address, if you would like it, is Help a Trini. That's HELPATRINI .wordpress WORDPRESS.com. So that blog is full of information on all various topics regarding men's health and other issues. I've also set up what I call educational autoresponders. So basically these are automatic responses for requests for information. So now you will need my email address, which is gprl3012@gmail.com. You'll need that email address to actually access these educational autoresponders. And to give you an idea of what sort of information you can get, if you're interested in finding out information about prostate cancer risk assessment, you can send me an email with the subject My Risk. So if you send an email to me with the subject My Risk, it will automatically send you the information on prostate cancer risk assessment. If you want information on prostate or the prostate gland, you can send me again an email with the subject prostate, and it will automatically send you information, as much information as you need on the prostate. Another topic that's of great interest to men is sexual health. So for things like, if you're interested in finding out more about the assessments that are done for men who are experiencing sexual health issues, you can send an email to me again with the subject IIEF, and that'll give you basically the first assessment tool that urologists who deal with sexual health. It's an assessment questionnaire that urologists use to help them get a better idea if you're having an issue with sexual health, where the problem might be. So it's the first step. Now, I believe that any approach to healthcare, should follow a format, and the format that I'm most familiar with is called getting your piece of the pie. And the pie is APIE. A stands for assessment, the P for planning, the I for implementation, and the E for evaluation. So you must have a very thorough assessment before you can create a plan. And your plan will have interventions, and the interventions need to be evaluated at some point, because you can't have interventions, that are really not giving you any benefit, whatsoever, and then keep going on and on and on and on. So you should be actually following up regularly with your family doctor to let him know, how the plan's working out. And if it's not working out, give him an opportunity to actually make some changes to help you, get the results that you're looking for.
Yep, so Mr. Webster, we were discussing sexual health. Of course, a topic again which a lot of men in particular shy, so to speak, of always discussing, even amongst their peers.
Right.
You usually find women discussing, about their sexual life with female friends and family members.
Freely.
But But men, for some reason, like, I don't even have a conversation. I didn't even have a conversation with a friend, with a male friend, a partner, as we say, about my sexual life. Why men operate that way? Like sometimes we ask ourselves, like, women speak so freely amongst their peers, and men just, everything is always, this macho type.
Well, for men, everything has to be perfect, right? Remember, we're bulletproof, right? You can't have any dents in the armor, right? It has to be bulletproof. And then there are a lot of men out there, in my opinion, suffering, needlessly.
Yeah.
I mean, some of these issues can be, easily resolved. I mean, sometimes, as you know, we have a lot of high blood pressure in Trinidad and Tobago, high blood pressure and sugar. And sometimes just getting your pressure into the right range and getting your blood sugar into the right range can make a whole difference, to your sexual function.
Yep.
Another thing too is, as men occasionally, we have issues with, sometimes you have a bad day. So you have a bad performance day. I mean, that happens to the majority of men. And what happens is sometimes when men have this bad episode, it creates a psychological block in their mind. So every time, every other occasion, that block continues and continues and continues. So it becomes a huge psychological problem. So sometimes it's physical, sometimes it's psychological. So a lot of specialists, what they'll try and do first of all is differentiate. Is it a psychological problem or is it a physical problem?
Yeah. How does men especially that consume large volumes of liquor or alcohol, as we say, how it really affects, how it boils down, and how it affects their sexual life?
It actually has contrary to popular opinion, it actually has a negative impact on your sexual performance. So, but to get men in Trinidad and Tobago to basically comply with the recommendation as to number of drinks a day is almost asking them not to breathe. And the recommendation for women is basically 1 glass of wine a day.
Right.
For men, it's 2 drinks. So how
many
men
like
in
one
Trinidad?
beer?
Yes, it's like 2 beers. So how many men in Trinidad are going to just have 2 beer? Right. So know that if you're going to be drinking large amounts of alcohol, right, you will have, you will be increasing your risk for sexual performance issues. So if you want to sort of, if you're having a sexual performance issue, that may be one area that you want to maybe have a look at and try and cut back on the amount of alcohol that you're intaking. Also smoking. Smoking causes what we call vasoconstriction. So it causes narrowing of the blood vessels. So blood vessels in your whole system that include blood vessels that feed, the penis. So smoking, if you're a smoker, one of the things you probably want to, to cut out or seek help in trying to quit is smoking, because it will impact on you negatively.
Also, these vapor cigarettes, these electronic cigarettes, is it the same effect it has in terms of your sexual health life, or? Well,
you see, I'm not, to be honest with you, I'm not really that familiar with them. I see men using them. I don't know how many men actually benefit from using them. Yeah, because a lot of people that I know personally have used them and gone back to smoking. Right. So I don't know how actually good they are at actually helping you to quit smoking. I think nicotine patches probably work better, but you want to use those in collaboration with your doctor also.
As you mentioned, alcohol, smoking. You have, that fluctuation in your sugar levels and all that.
Well, your pressure.
And
your
pressure and sugar.
Your cholesterol.
What else affects men's sexual life? What can attribute to,
Could be a hormonal issue. Like I said, testosterone level could be very low. And sometimes, men go and get testosterone replacement. You'll find on the internet a lot of products, tablets that you can take, that claim, that the testosterone will be used. Well, you can take oral testosterone. Testosterone taken orally is basically destroyed by, your stomach acid. So it has to be given in either transdermally or intramuscularly. And intramuscularly is the best way to actually, to get it. Another thing that men should be aware of is, and I think, healthcare providers, I'm not sure if they're following this guideline, but men should be checked for prostate cancer before instituting testosterone replacement therapy, because testosterone actually feeds prostate cancer. So if you have prostate cancer present already and you start taking testosterone, you're basically just going to feed it. So men should be getting checked to rule out prostate cancer before, starting any aggressive testosterone replacement therapy. And I don't think that's happening a lot in Trinidad and Tobago. So for men out there who are considering testosterone replacement, speak to your doctor about, ruling out your risk for prostate cancer before you get started. And be careful. There are a lot of young men out there that are going and getting this testosterone boost, hoping to get this boost in their sexual function.
And that could be more detrimental, not so?
Absolutely, because what happens is getting the injections is getting what we call exogenous testosterone. You're getting it from the outside.
Right.
When you're taking testosterone from the outside, you run the risk of your body stopping its own testosterone production.
Right.
So what eventually happens is you get totally dependent on external, testosterone. So you have to be very careful with that. And doctors would, probably do in-depth assessment before they would start, that sort of treatment.
Yeah.
But it seems to be, rampant. Fellows are getting it, left, right, and center. So if you're having a problem, and I see a lot of men come and complain about a reduction in the quality of their erections. And, a good urologist will tell you, well, let's check these other things that we know men are having problems with first. Exactly. So don't jump on the Viagra or the Cialis and the Levitra. Find out, make sure you know what the cause of the problem is or what it could be before jumping on board.
Well, what about those names you just mentioned there? Mm-hmm. How that affects men's health on the whole, apart from their sexual health, just health in general?
Well, I don't think it has really a very negative impact. I mean, for men who don't have an issue with erectile dysfunction, those drugs actually don't give you much improvement in your function.
Right.
It's mainly for men who have issues with sexual function. So if you think that going and getting the extra Viagra or Cialis or Levitra tablet is going to make a big difference in your sexual performance, if you don't have an issue, it's not.
Okay.
It's a big myth. Another thing that young men have issues with also is something called premature ejaculation. Mm-hmm. And there could be many reasons, for that. So, as I say, if you're having these issues, go and get checked. Find out, is it, for young men, a lot of the issue is inexperience. A lot of men also, it's oversensitivity of the penis. And there are things that can be done, to help, reduce that sensitivity and improve function. But the first stop has to be a doctor. You have to have a complete assessment.
Yep, so to all the young men out there, like myself, you need to take stock early as to what's happening. And not only, you need to come out there and actually talk to somebody. Because you can't just keep it within if you're having a sexual dysfunction, so to speak. You need to come out and talk to maybe your best friend. It might be kind of tough to discuss with your parents if you're pretty young. Your partner might be the best option.
Absolutely. Or send me an email, or give me a call. Tell me what's happening. Maybe I can refer you, to someone who can help you, with that issue. But don't sort of sit in a corner in the dark and suffer needlessly. I mean, a lot of these issues can be resolved, without much intervention. So just be aware, that your help is out there and it's only a fingertip away. For the older men out there who are having issues with prostate enlargement, there are novel approaches coming out. The problem is in Trinidad and Tobago we don't have access to a lot of these novel treatments, for these issues. So we need to get these new treatments into the island. We can't sort of stay in this old school all the time. We need to get access to these current treatments that are more beneficial to men in the long run. You have less side effects, your recovery rate is faster, so we'd like to see new treatments come into the island to help men who are having these issues with enlarged prostate and especially new prostate cancer treatments, new focal therapies that are available. We'd like to see them come into the island. So I think the ministry could start looking at getting some of these new treatments into the island.
To help all our citizens.
Mm-hmm. Our citizens need help, yep. And this, we know the standard of care. Look, even if you go to the doctor today, doctors are still doing these written notes when we've had, electronic medical records, for years and years and years and years. And the thing is, with all these written notes, what the doctors are actually doing is setting themselves up, for malpractice issues. So why set yourself up? Get current. If you don't know
so much technology to take advantage of.
Absolutely. Like I just said, you can send an email right now and get information on the prostate in seconds.
Yeah.
You don't have to wait till the library opens, go to find the book, and we don't have to do all that anymore. Technology today.
You can even get the information online.
Smartphones.
Yeah, you just go up on Google and search whatever you like.
And it's all there. The key is finding reliable sources, because there's a lot of garbage also on the internet. So you want to know that the location that you're actually getting this information
is reliable.
It's a reliable source. Yeah, it's important. So we're talking about men's health this evening. We had no calls in yet. I guess the guys are all listening and nobody wants to call. They're waiting for someone else to take the lead on that. But our number here is 628-4103, or you can choose to log on to 103fm.net or send us a text at 4103. We're going to take a break right now, so don't touch that dial.
So welcome back inside the show. Welcome back inside your Men's Health Clip Hour here on 103 FM.
And see, we have a call on the line. Yes, welcome to 103 FM's Men's Health Clip Hour. You're live. Do you have a question for us?
After the use of Zoladex and radiation, could a person live a normal life as before?
Well, so it depends on what you regard as normal. I mean, things are basically never 100% the same. After you have a diagnosis. Now, if you're getting Zoladex...
if one is diagnosed with prostate cancer, and read up to, say, 63, 43...
I beg your pardon?
Could that be eliminated with Zoladex injection and radiation?
Okay, so Zoladex and radiation is generally given to men who have what we call advanced disease. So disease has basically left the prostate and gone elsewhere. So Zoladex is one of the medications that is given to cut off basically your testosterone production. Because as I mentioned earlier in the show, testosterone feeds prostate cancer. So the Zoladex basically is to cut off the testosterone production so it doesn't feed the cancer and basically slows down its growth. Now radiation is given to treat prostate cancer, but even radiation, you can only have so much of it. So they leave the basically radiation, and they basically give it sparingly because you can only have so much of it. Once you reach your limit, basically that's it. So if you're getting Zoladex and external radiation, it's basically for prostate cancer that the more aggressive type of prostate cancer. And men can live a normal life. When you say normal life on that, I mean, life is never the same as it was before your diagnosis, but, you can still enjoy a lot of the things that you were enjoying before and do a lot of the things that you were enjoying before, even with a diagnosis of prostate cancer. So it's not a death sentence. Does that answer your question?
Where is your place, Chief?
I'm located in Curep, so if you want to, you can give me a call later on at my 638.
Right.
My telephone, my office telephone number is 683-6145.
683
6145.
6145.
Yeah. So it sounds like you need a little bit more information on Zoladex and radiation treatment. So why don't you give me a call and I'll be able to give you some more information on what that's all about.
Okay.
Okay, thank you for your call. Yeah, so, Zoladex and radiation, that's the whole key. And that's why, I say to men, go and have a risk assessment. If there's prostate cancer there, majority of the time, it's a slow-growing cancer that probably doesn't need anything done, just monitored, right? But if you just sort of leave it, you have prostate cancer that's aggressive there, you leave it, it leaves the prostate and it goes into your system, then it becomes a huge problem because if you can think of a little cancer cell and many of them all over in your bloodstream, wherever the blood goes, it goes. So it's hard, basically, even with radiation, you can only give so much because, you give a little bit here, you give a little bit here, you give a little bit here, and then basically you run out of radiation. So it's important that early detection is always the best way to go.
Now, Dennis, we were talking about prostate cancer for the last few minutes, all right? Just tell us simply some of the symptoms or some of the signs as to prostate cancer.
Okay, so
for the young men listening in.
Okay, so that's a big question you just asked there.
Yeah.
So if you're waiting for signs of prostate cancer, that's a bad thing.
Right.
Because by the time, if you're having symptoms and they're related to prostate cancer, it's probably prostate cancer that's already left the prostate and gone into your system. So you'll get things like back pain, you may have blood in your urine, things like that. And at that point, you're dealing with a more of aggressive scenario.
Right.
Okay, so like I say, the key again is to have a prostate cancer risk assessment. And the risk assessment will tell you what your estimated risk is for having the deadly form of the disease. Because we don't want to treat all prostate cancer. That's a problem.
Yeah.
You get over treatment. You have men getting treatment that they really don't need. They're having all these symptoms that they have to deal with after the treatment. And what for?
Yeah.
So we only want to deal the cancers that can take your life, not those that are going to be just hanging around,
Just
forever.
Yeah.
So it's important that people understand, basically that concept is that we don't want to treat all prostate cancer and we don't want to find all prostate cancer. We only want to find the deadly ones.
Correct.
Okay, so get a risk assessment. That is according to current guidelines today. Going for that total PSA test, the only value that total PSA test really has is if you're already on treatment for prostate cancer. Because at that point, they're looking to see if that level is going down and down and down. Okay, so don't wait for symptoms of prostate cancer. Right? That's the last thing you want to wait for. You want to make sure and try and find it before it leaves the prostate.
Go get it checked out early.
Earlier the better. And as I say, for men, according to the Cancer Society here, starting at age 40, and if you've had a brother or a father who's been diagnosed with prostate cancer, you should be starting earlier, probably around age 35. So speak to your doctor. These are things that you can speak to your doctor about, right? And your doctor should be able to give you, current information on these topics. That's what, good healthcare, is all about. So for men, you talk about symptoms. A lot of men have symptoms, but a lot of the symptoms are related to the non-cancerous enlargement of the prostate.
Right.
So this urinary symptoms where your stream is interrupted, you're getting up a lot at night. Now it also could be, remember, urinating a lot could also be diabetes. So you want to rule out, that you don't have diabetes. But generally those are the symptoms, incomplete emptying of your bladder. You finish urinating and you feel like your bladder is still full, that there's still urine in there. Those could be signs of the non-cancerous enlargement, not necessarily prostate cancer. Could be prostate cancer, but this is why you want to have a risk assessment to check to make sure it's not. So that's basically the message that, I basically want to leave men, with today. For the partners, ladies, thank you for calling in. You notice that the ladies are calling in because they're very proactive about taking care of themselves.
No, we were talking off the air. Now, had this been a all-woman show, we wouldn't have had any space for calls.
Well, looks like we might have to change because the fellas, no one's calling in. And I know they have questions. Because I'm meeting them every day on the street.
But they won't call.
Right?
Guys, you need to be a little more brave, a little outspoken, and, call us. Nobody can see you. They can only hear you. Mm-hmm. They can't see you, so just call us and ask your questions.
Your partners are calling. Like, your wives call. They call. They go and get themselves checked. They know the importance of it. Why are we men, so lackadaisic? We need to get active and get these things checked out. It's the only way we're going to improve our health. So if you want to keep quiet and keep doing the same thing you've been doing for all these years, you're going to get the same results.
Yep. So we're just about 3 minutes before the top, Mr. Webster.
Mm-hmm. So basically I want to talk to the ladies out there because those are the ones who seem to be more proactive. So to the ladies out there and to the partners out there of these men who are afraid to call in, please get them to get themselves checked. Okay? If something happens to them, they're going to be off work. There'll be issues, and it's going to impact on the whole family. Whatever plans you've made, and you made, with your partner, when you got into this relationship, if you want to realize them, part of it is keeping them safe. So if it takes prodding them to get them to go get checked, please do so.
Yep. And the earlier, the better.
The earlier, the better. You've been listening to the first and the finest.
Tonight's Men's Health Clip Hour was brought to you in part by our friends at Val Park Chinese Restaurant. So much thanks going out to the crew there at Val Park Chinese Restaurant.
And thank you again, ladies and gentlemen, for joining us on this Health Clip Hour. We look forward to seeing you next Tuesday. I'd like to touch again next Tuesday on that topic that the lady talked about the need for, some sort of medical, advisory board to deal with, these negligent cases. Because it's getting out of hand in this country, and we need to get a handle on it. So till next week, see you then.